Hello again. Welcome to our channel, Thai Food for Tater. My name's Alicia. Hopefully you had a chance to watch some of our other videos, especially the one where we kind of give you introduction to who we are. So it's myself and Laura, and this is our channel together. Some of our videos, as you know, are us together, with some commentaries and back and forth. And then we also have our own videos where we have, more of this one-on-one where you're kind of just hearing one perspective. So in our introduction and some of our other videos, we talk about, and this is definitely one of the main themes of this channel, is talking about our very specific medical histories, the treatments we've gone through, the diagnoses we've had, and hoping to relate to many of you on this and share our experiences with you, and hopefully to add something positive to this for many of you. So I know, like, when I was going through a lot of this with my medical shit, that I wish I would have had something like this, and not that there isn't other content out there, but I feel like in this more approachable way. So hearing someone's personal experience with this. So I recorded a video before about my pre-diagnosis with breast cancer and getting that diagnosis, and then kind of the initial, like, what was going on with my physician and that initial appointment or two about the diagnosis of what it meant for me. And so now this is going to be kind of the next one. It's going to be a video on the part of the treatment that I had, chemotherapy. So this is going to be fun video. Oh God, and I mentioned this in the past video that not everyone has gone through who's had cancer has gone through chemotherapy. It's not always required for everyone, depending on your personal situation, depending on the type or stage of cancer that you have. But for me, I had the trio. I had chemotherapy, surgery, and radiation. And the only thing I knew about chemotherapy was what I'd seen in movies or TV. Like, I had no idea. And so there's no way to put in words how difficult chemotherapy is. And for those of you who are watching who have been through it, and like, everyone experiences it differently. Some people have, slightly difficult time with it. Some people have a horrific time. Some people don't make it. They die because of chemotherapy. It is more horrific than you can imagine if you've never been through it or never known someone who's been through it. There's no way to put into words how it makes you feel, and I'm going to attempt to do that with this video. So to kind of continue with what I was saying in the previous video about diagnoses and those initial appointments, my doctor had told me, my oncologist told me, you're gonna have to go through chemotherapy. They're gonna be 8 treatments. They'll be 2 weeks apart. You're going to have 4 with this one drug called adriamycin, and the other 4 with another drug called Taxol. I had to think about it for a second. And like, when she's telling me these, I'm writing it down. Like, I have a notepad with me because I'm like trying to be like, proactive in my health. But I'm like, I don't even know what these mean, And but then she kind of gives me some general information. She said, these are common chemotherapy drugs. Adriamycin is one of the strongest ones. We have to make sure that your heart is healthy. So they sent me in for an echocardiogram because this drug, adriamycin, can kill you. It can and does do extreme damage to the heart. In fact, if I ever get cancer again, I can't have that drug. It will kill me. And so I was like, good Lord, thinking, oh no, I've got a snotty dog in the background. Got a doggy with allergies. Let's give it a second. Oh, baby. You okay? Oh no. Oh, I think she's okay. Okay. What was I saying? Adriamycin. And so they sent me in for the echocardiogram, and that came back. My heart was healthy, healthy enough, for the drug. And so it was a very quick, like, I had the initial appointment with my oncologist, and she's like, we want to start you on chemo within a week, so we need to get you in for a chemotherapy port. And I was like, what's that? Because like I didn't know. And so she's describing it to me. She's like, we don't want some of the chemotherapy drug it's literally poison. We don't want to get on your skin. We don't want to be accessing the same veins over and over again. It can be really damaging to the veins. And so you get this thing implanted in your chest. And I was like, what? And so you can see here my scar. I had them remove it when I had my surgery. But basically, they put this device in. It's small, but you can still see it. Like even when I had a shirt on, you could see there was something, there. And, you can feel it it's under your skin. But it sits there and basically it attaches to the veins. And so they only have to have a small layer of skin over it. So when they access it through the needle, when they're giving you your medication, you just get a poke through the skin. And then the port is connected up here in the vein, and so it's not always shooting. It's not like they're accessing the vein directly every time, and so it's like less damaging overall. It's easier access, and so they sent me in for this, and when I got in, they what? There's one thing I forgot to say. Let me back up a little bit. So I knew I was going to lose my hair. And I had very long, like my hair's, I've trimmed it a lot over the last couple of years, but I was lucky that it grew out pretty fast. I'll talk a little bit about that more in a minute, but my hair was quite long, and I knew that it was going to be falling out, and I didn't want to have that psychological and emotional turmoil of seeing giant chunks fall out. So I shaved my head, preemptively, which is very common. One of my friends came over, we shaved it. And at the time I was still like very like, I'm going to get through this, trying to be positive. And so, luckily I looked okay with a shaved head, because it was shaved for about 2 weeks before I actually lost it all. And I was like, okay, I can deal with this. I'll tell you, some of you may know, you will look very different with a shaved buzzed haircut than you do with no hair. It is a very different look. And, like that's something I'll kind of talk about later on in this video, but so I'd gone in, I have a shaved head, I'm ready to get this port implanted, and they asked me, do you want to be put under or do you want to be awake? And I was like, oh, well, going under terrifies me, so I'd rather be awake. And so they're like, sure, no problem. I probably should have opted to go under, because the whole procedure was like 10 minutes. Well, I was like, yeah, I'll stay awake for 10 minutes, whatever. Because they tell you, it'll be uncomfortable. That's code for it's going to hurt. It's going to probably really hurt a lot. But because I'm sure some of it, for some people, it was just uncomfortable, and other people it's painful. And they don't want to scare you, obviously. I understand that. Because then the more anxious you get, probably the more painful it will be, of course, But also, be fucking honest. It's going to hurt. It's going to hurt a lot. It's going to be really traumatizing. That's exactly what it was. And I understand that was my experience, and everyone has that experience. There might be some of you watching are like, I was awake and I barely hurt at all. And some of you, though, will know exactly what I'm talking about. They give you medication. They give you something to like a muscle relaxer to like calm you down. And they had an IV, with fluids and stuff. And they lay me on the table, and I'm a little nervous. But at this point, like I said, at this point in my cancer journey, I'm like, the only really painful procedure I've had is the biopsy. And so I'm just getting into, how horrific this whole process is going to be. And so I'm laying on the table, and they put, something over your face so you can't see, obviously for like sterilization protocol or whatever, you have to keep everything covered. And I could feel like they just have a spot open on this paper where they can see, and so they tell me, you're going to feel some pressure and some pulling. I'm like, okay, I can deal with that. Well, yeah, technically it's pressure and pulling, but they don't tell you it feels like they're ripping your lungs out. They're like, in reality, it's probably not that much, but you know what I mean? It felt just like my whole body was being moved around. And I was just crying and crying. I'm laying still because I know like I have to lay still. They have like a scalpel next to my neck, because so they go in, I don't know if you can see on this video, there's where the actual port is, but I have a smaller scar here. They have a little incision they cut so they can kind of reach in and pull, the tubing. And so at the time though, it looked like I had been hit in the chest with like a sledgehammer. This whole thing was just purple and yellow, and like it hurt so bad. And I walk out of this room, 15 minutes later, and I just remember thinking, like, they had me sit there for a few minutes afterward to make sure I wasn't going to pass out, because you lose a little bit of blood, and plus it's traumatic to your body. You're just like, what the fuck is happening? And I was just like, good God, get me out of here. I just want to go home. I want to die. Like, I was in so much pain, and it was so painful for me. And I walk out into the waiting room where my boyfriend was. My boyfriend at the time, he was waiting for me. So, because I've been in the back for a while, because they have to you have to change. You get into a gown. They set up the IV. They get you in there. So it's probably been 45 minutes to an hour of the whole thing. And so I walk out, and he can just tell. I almost felt like I was gonna pass out. He's like, let's just get you home. So I got home and I rested on the couch the rest of the day. And I'm thinking, okay, it's bad. Of course it's going to be bad. I just had this major, minor surgical procedure, but I'm going to be okay, But then I knew that I had chemotherapy coming in I want to say, I think it was either 3 or 4 days that they're going to access this thing. They're going to poke a needle through this. And I already felt don't even blow breath towards it. It hurts so bad. So I go in a few days later, and, and also the nurses, actually, I think this was the day before I got the port implanted. They bring you in for a chemotherapy, what do they call it? Educational session, and they just give you a bunch of information. And I had some great nurses. One of my favorites, she was kind of with me through most of my treatment, Nurse Sam. She was incredible. Because, you obviously have your oncologist, but for those of you who have been through this, it's the nurses who you interact with more, and who know you better, who know you as a person a little bit more. Not that the doctors are great. At least my doctor was amazing. But I only saw her, even at the beginning when I saw her once a week, or then once a month after a while. The nurses I was seeing, for long periods, they saw some shit. They see you in your lowest moments, and they see all this, and they're there to help you. And so they were great. But so Nurse Sam was going over this with me. Sorry, I had a video coming in. Okay. Let me just 1 second, please. So she gives me this list. It's, how many times in the course of your cancer journey are you going to get a printout of something, and they want to give you the information, and I love having the knowledge, but there's just so much stuff coming at you. You're like, okay. And so she sits down with me, and she's like, you're going to be in here once every 2 weeks. We're going to start you out with this drug, adriamycin. And, then she gives me a list, piece of paper with a list of the common side effects. And I knew, of course, as a fairly intelligent person in the world, of what to expect. Hair loss, of course, I knew that was coming. Nausea, fatigue, and I'm thinking I can handle that. And this whole time I'm also remember, I'm a PhD student. I have a job. I have 2 jobs, and so I'm thinking I'm gonna get through this. I'm gonna do all this. I'm gonna be the best. It's not gonna stop me, And it didn't, but I regretted that I didn't take time. I'll say that. My oncologist encouraged me to quit my job, and I was like, well, one, I have to keep my job for medical insurance, But I think my job, they told me they would work with me on reducing my work hours and all this, and it was just yeah, but I didn't want to let it interfere, and I felt like I had something to prove, especially as a graduate. For any of you who are in grad school, it's being a graduate student. People who are not graduate students don't understand the pressure that is on you, and imagine for many people being healthy, absolutely tip-top health, now throw cancer in, it was a nightmare. And so I'm thinking, okay, she's giving me this list of things, and you see them, you see the words, nausea, fatigue, and there's 20 things on this list. You're thinking, okay, am I gonna have all those? I did, and more. They only give you the list of the most common. And so for many of you, you probably have experienced this where you're I'm having this symptom that's clearly related to chemo, and it's number 50 on the list because only a few people ever get it, but you happen to be one of those people, Jesus Christ. So they give you this list, and you take in that information, but you don't know, you see the words on pain, you see that word on a piece of paper. It doesn't prepare you for how it's going to feel. And like, when people ask me like, what was chemotherapy like, I say chemo is torture. It's torture. You are literally being poisoned for however long you're going through treatment. I was poisoned for almost 5 months. Imagine what your body like, you are literally dying. The chemo is killing you. The doctors are just hoping it kills the cancer before it kills you. And so imagine you go through 5 months of being poisoned. Like, what does that feel like? Every system in your body begins to shut down. And so I was healthy 34-year-old, and then 35, I was still going through treatment after my birthday. And you, like, it's torture. It's fucking torture. But like, I didn't know that going into it, you know, and she even told me the first treatment you're not gonna feel the full effects, because they're cumulative. They're gonna get worse and worse. And so after the first treatment, I was like, okay, you know, definitely felt drained and tired, had some discomfort and pain the next couple days. And for those of you who don't know, it depends on like your cycle of chemo and what drug you're getting, but there's usually kind of like a cycle. Like the first day or two aren't so bad, and then like for me it was like day 4 through 10 were like the worst, and then at the very end, before I had my next treatment, like, you know, day like 9 or 10, 11 or 12 or whatever, where I felt like a little more functional. I never felt fine, but I felt a little more functional. And so then you had to repeat the cycle again, you know. And so they told me it'll be about 14 days after your first chemotherapy that your hair will fall out. And so that would have been like the day of my second treatment, because I was getting it every 2 weeks. And so, you know, I'd shaved my head. It was probably still about like half an inch, 3/4 of an inch, you know. So I still had a decent amount of hair. My hair was very thick. And so, you know, I noticed a little bit coming out, but not a lot those first few days. And then it was day 14. It was like to the day, and I was in the shower, and I was like, I wonder when my hair is going to start. Oh God. Like, it was just like wiping away just hair. I was like, oh my God. It was just, so in the shower, I just kind of, you know, got it all off. And for the most part, there was still a little bit, you know, scraggly pieces of it. And then of course, over the course of the next few days, it basically just all came out. Except I had this random spot, like in the back of my head, you know, maybe like this size, like just like right here, that the hair was always there, like, which is common to have areas that the hair doesn't, you know, fall out. My eyebrows, I lost my eyebrows. As you can see, my hair grew back, because some people, their hair doesn't actually grow back after chemo. It can happen. Your hair can grow back different texture. If you had straight hair, it can grow back curly. If it was curly, it could grow back straight. Different color. Apparently this happens a lot. Mine was the same texture. I have naturally kind of wavy hair, you know, kind of straight, kind of wavy in places, and same texture, but it came back a different color. My hair came back about 70% gray, white, like silver. And I was already like genetically, like my dad went gray really, really young. And so I was already in my mid 30s, already starting to get like a couple little gray hairs here and there, you know, like maybe more so than the average 34-year-old, but not like crazy excessive. And after chemo, it was like 70% silver. And so I was like, and so I tried to keep, because my hair's naturally dark brown. I tried dyeing it dark brown, like after all my treatment, when it started growing back, but it was just useless, because you could always see the gray. And so I went blonde, the gray is hidden. And I just touched up my roots the other day, so it really looks nice. You would never be able to tell. I mean, it's very dry because it's gray hair. It's very dry, but you know, it looks okay. I mean, it's not the end of the world, my, you know, hair, whatever, but just so you know, it can grow back very differently. And my eyebrows never really grew back, though. You can clearly see I draw them on. I know that's kind of trendy now, but that's not why I do it. My left eyebrow grew back about 70%, like most of it kind of came back. It's still kind of sparse, but the general structure of the eyebrow grew back. This one, only about 20% of it grew back. So I have to draw them on, you know. And when I don't draw my eyebrows on, I'm sure I'll do a video without eyebrows. And you can kind of see, like, there's a shadow on this one, looks okay, and this one you're just like, there's no eyebrow there. But you know, so my hair's falling out, my eyebrows. You don't think about it and say you're gonna lose all your hair. You don't think about how functional your hair is. So like, it keeps your head warm, and I'll tell you, I was cold all the fucking time. Like, you will be cold, you're being poisoned, your body's shutting down, you're gonna be really cold. And so you don't have that natural warmth on your hair, on your head, and you lose, I want to say something, you lose like 70% of your body heat through your head. So As a suggestion, if you're just starting chemotherapy, get some beanies. It's a really common thing people know, like you have to, because you will just be really cold. But you, like I was saying, you don't really think about how functional your hair is. Like all my eyelashes fell out, and you don't think about how functional they are. So my eyes are constantly watering. Like just there's something to catch it. There's something to catch anything. You know, your nose hairs, which at first I was like, cool. Like no, but then you don't realize, oh, those are functional too. And so you're just a snot all the time, because your body's doing a bunch of crazy shit. And you know you don't have all these natural things to, even the little baby hairs like on your face or your arms, you don't think about. And then also at the same time, like, and this is what kind of what I want to get into for the heart of this video is the side effects, like exhaustion beyond anything you can imagine. For me, it felt like, and I'm not exaggerating this, it felt like after every treatment I had been hit by a car. I couldn't touch my skin. It felt like I was just a walking bruise. Even putting a blanket on me, because I'd be so cold, even the blanket hurt. Like, everything hurt all the time. And in a way, like, you can't describe, like, everything hurts. Like, it just hurts, make it fucking stop. It hurts so much, you know. The nausea, for me, the nausea was bad. However, I'll say that the antiemetics or the anti-nausea medication that my oncologist prescribed worked really well for me. So I was very fortunate that worked well. But I would have days where I would be like, I didn't want to even look at food. I couldn't. And the days where I like would just eat a whole pot of spaghetti. Because this is common for a lot of people in the chemotherapy. Part of your treatment is like steroids. This helps with some of the side effects. And so I was definitely like, I wouldn't eat for like 2 days and then I would just gorge for 2 days. Like, cause I would have no appetite because I would be in the depths of these symptoms, side effects. And then I'd be like, oh, I'm finally feeling better. I need to eat. And then I'd be like, I haven't eaten in a week, you know, so I'd just be so hungry. And I'd be like, carbs, you know. But, you know, so your appetite's all fucked up. And then after every treatment, the symptoms just get worse and worse. And so I literally, my doctor told me, if you do 8 chemotherapy treatments, the surgery and radiation, you have a 93% chance of surviving this. And because I'm a numbers person, I was like, those are great odds. I just have to do this stuff. And I'm, you know, more likely than not, like, gonna be totally fine at the end of this. I just have to get through it. And after my 3rd chemotherapy treatment, I seriously had a discussion with myself, like an in-depth discussion with myself about whether I was going to continue. That's how bad chemotherapy was. I honestly thought, can I do this? It was a true, like, for days, I considered it like, I think I would rather just die slowly of cancer than to go through another chemotherapy. That's how bad it was. Like, it was so fucking bad. And like I said, I don't want to say this to scare any of you, but just know, like, if you're starting this, there's nothing in the world, in my experience, because I've been through some other, you know, painful things in my life, physically painful. Like this nothing compares to this. It is horrific. It's horrific. And, you know, you know, your body, your systems are shutting down because they're being poisoned. And so there were times I couldn't walk. When I was on the Taxol chemotherapy drug, one of the common side effects is neuropathy in your hands and feet. So like numbness and tingling. Well, I didn't have that, but I had a very less common side effect, which is severe joint and nerve pain. And the pain was excruciating. I couldn't walk. And I had to have, my boyfriend at the time had to literally carry me from the couch to the toilet so I could pee. Even though I live in a small apartment and it was all of, you know, 15 steps. I couldn't do it. And I would just be laying in agony. And I remember my mom was here visiting and they were on the phone with like the advice nurse, like, what do we do? Like, it's just pain, but she's screaming. Like, and I was just, you know, I hear sometimes people will say like emotional pain is worse than physical pain. And while I agree with that to an extent, like I've been in scenarios with people where the emotional impact of what they've done is way more, can linger and stay with you. I totally get that. But I will say that I think a lot of times when people say that, they've never been in a situation where physical pain is at its most extreme. And I don't want to be in any pain. I don't want to be in any physical pain, psychological pain, emotional pain. But I will tell you, I never want to be in that kind of physical pain again. I think I would opt to have a little bit more emotional pain in my life if I could avoid that. It was horrible. There's also, for most patients, there's also a taste you have in your mouth. For me, I would describe it as metal and snot. It's disgusting and it never leaves. The other symptoms, you know, you're in pain, you can get pain meds, which I did. I did have pain medication, which helped most of the time, or at least brought the pain down to where I wasn't screaming. And you know, when you're nauseous, when you're nauseated, you can have the antiemetics, those will help. But that taste, there's nothing. Like, I would try like hard candy or, you know, gum, and it was always there. And so even though it wasn't the worst symptom, it was probably just the one that just, I think, was more like ate away at me psychologically sometimes, because it was like, I couldn't escape it. You can't escape it. Everything else, like, you could have maybe good days with the pain, or the pain meds would help, or good days with your appetite. You knew there was a good day coming, even if you were having the worst day. You knew, like, if it was Tuesday, Thursday was going to be better. But with that taste, it just never left. And so that one was really hard. But the physical pain, you know, I had. I mean, I'm trying to be very open with this. Like, I had a difficult time. This is very common, being like constipated or diarrhea, constipation, diarrhea. You know, so I had really bad hemorrhoids, and for like weeks I couldn't sit down. I had to, like, if I was in the car on my way to the doctor's appointment, I had to sit on my side. I couldn't sit because it hurt too much. And I remember one time my mom was here visiting. She would come in for, like, you know, she'd stay for like a week, like every few weeks she'd come in, she'd fly in and she'd stay. And she, one time I was in bed and I was just crying, I was in so much pain, and I was like, Mom, you know, I gotta fart, but it's gonna hurt. And we were laughing, and then finally I was able to fart. Because every system's just, you know. And we laughed, but I was crying. And it's funny now thinking about, like, that moment in particular. It was funny, but also I just remember being, like, trying to laugh through the pain, because it was like, you know. And many people have hemorrhoids, but imagine, like, and I know, like, it's not just with chemo. There are other things that can happen in your life where maybe you have really bad hemorrhoids, but you know what I'm talking about. It's fucking horrible. And it was just, it's like this. It's like imagining, like, you have the worst hemorrhoids possible, the worst arthritis pain you can imagine, the worst disgusting taste in your mouth at all times. You can't necessarily control when you go to the bathroom, and you have to be really fucking careful because you might pee yourself because every system's shutting down. Also, every inch of your body is hurting, in pain. Your skin, you can't even have clothing touch your skin. Like, imagine all of that happening at once. And then imagine, like, what that does to you psychologically, what that does. Because, like, how do you, like, when you, and this was my problem when I went to the doctor, I'm like, it hurts, everything hurts, make it stop. Like, but you know, like, you know, you have to go through this. And I felt like this weird emotional, I don't know how to describe it, like, I was doing this to myself, like, because I said, yes, sign me up for chemotherapy, I'd like to kill this cancer, please. And so I signed up for this torture I was putting myself through. And I felt like, in this crazy weird sense, even though I knew it was the treatment I needed, I felt like I had betrayed myself, because it was in so much pain, and you don't see anything past, at least I didn't. It was so hard to see anything past that pain. When you're in pain, when you're in horrific physical pain, you can't see, oh, the end result, or like, this is going to benefit me. You just know you're in pain, and people will ask, like, is there anything I can do to help you? And, like, what do you say? Like, yes, please, can you invent a machine to take this pain away from me and give it to you? Because I can't even fucking deal with it right now. You know, I remember being like, and everyone in my life was like, you're dealing with this so well. Like, people who weren't there on the day-to-day, like my boyfriend at the time and my mother, like my friends and my colleagues. And, like, you don't know. I threw up in the lab when no one was around. You don't know that it took me 10 minutes to get up one flight of stairs because the pain was excruciating in my feet. And then I put on a face, wiped my tears away and put on a happy face when I walked into the room, you know. It's torture. It's fucking torture. If I If I found out I had cancer again and they told me I had to go through chemotherapy, I honestly don't know what I would do. Like, I don't know if I could do it again. Especially now with all the side effects that I've been dealing with from chemotherapy. Like, I have, from the Taxol, I have long-term, it's been 3 years now, permanent nerve damage to my legs. In my 20s, I had some issues with my feet and legs. I had some nerve issues that I had fixed with some surgeries, and the chemotherapy came along and aggravated not only that old condition I'd had, but in general just fucked up all the nerves in my legs and feet. And I have a difficult time walking I'm 38 years old, and I can hardly walk sometimes. And they sent me to physical therapy. I was in physical therapy for like 6 months, and they sent me to like 2 neurologists, and basically there's like, we can help you a little. Physical therapy helped me a little bit. But I fall all the time because my left leg will just stop working. And then when that's not happening, the pain is excruciating. I'm still on pain medication, a lot less than I was. And I hate that I still have to take it sometimes, but 3 years out from chemotherapy, one of my nurses, she was like, the gift that keeps on giving. And I'm like, yes, chemotherapy is really fucking horrible when you're in it. And then for most people, there is some kind of long-term side effect from it. And so for me, it was this nerve damage. That'll never get fixed, because so for the rest of my life, I'm going to have that. And so to think about if I had to go through that again, I don't even know. I don't even know if I would do it. But I went through four rounds of adriamycin and 4 rounds of Taxol, and the Taxol with the joint pain was horrific, but the adriamycin by far was the worst. That was the worst one. And for those of you who are taking, it's bright red. They call it the Red Devil. And when I first heard that, I was like, oh, that's funny. And then little did I know, like, it's true. I feel like, I don't know, for those of you who are watching this, I don't know if I'm getting this across to you. I'm trying so hard not to cry through a lot of this video because I really want it to be, I don't want it to just be me crying in a video. I really want to try to get this information to you. I hope that I'm doing a good job describing this to you, because I feel like there aren't words sometimes. And even 3 years out, I still, like, when I go in for my monthly shot, I have to get a monthly shot of Lupron as an estrogen blocker. When I go into my oncologist's office, the few times where they're like, oh, can you wait? We're not quite ready with the shot. Sit in the infusion chair. So the chair where you sit in where you get chemotherapy, I have had an anxiety attack multiple times. And sometimes when I walk to my oncologist and I smell certain smells, it reminds me of chemotherapy specifically. Anything that reminds me of chemotherapy, like, it is just, my body just reacts. Like, I just have this crazy visceral reaction, especially to smells. And I'm back there in that torture. And it's been really hard. It's been really hard to be like, I'm fine. And I'm not, like, nothing can prepare. Like, I still think about this a lot, this list they give you, this list of words, I mean, fucking nothing. That they can't tell you, you are going to be in the worst pain of your life, very likely. Be prepared to understand what it's like to be slowly poisoned for the next 3 to 6 months, however long your treatment is, and what that's going to be like for you, and how every system in your body is going to start shutting down, and like how close you're going to feel to death without actually dying. And to imagine, like, me being a normal, healthy, functioning person in my 30s, and then in a few weeks going through that, and like what it does to you, emotionally, physically, existentially. I know I dwell on it a lot, and like in life in general, but also in this video, like the pain, because I've been in pain for the last 3.5 years because of this. Now, the pain now that I'm dealing with is much more manageable than the pain of chemotherapy, but chemotherapy, like, prepare yourself mentally. Like, if you even can, expect the worst, and maybe it won't be that way for you. Please God, like, I hope it's not. I wish that it's not for everyone, but I know for many of us it is. It is really, really horrific. Okay, I think I've kind of said everything I want to say about chemotherapy for now. I might bring up some other stuff, but just, you know, thank you for listening, and I'll catch you guys in the next video.